Welcome to Business Upfront, where we talk with entrepreneurs and innovators about the methods and mindsets that goes into running their business. I'm Doug Vai. Let's dive right in. Today, I have Kim Siegenthaler on the program. It's so great to have you here. You drove all the way from Arlington. We are in Frisco, Texas, broadcasting from the VentureX studios in here in Frisco. So the drive was not too painful?
No, it was easy.
Was it? How long had it been since you've been out in this area?
Not too long. About a month. I came out for a wedding.
Oh, did you? Okay.
But today there's good coffee and good people.
So good people.
Good drive.
We love it here in Frisco. There's lots of new development going on. But the development I really want to understand more about is your business. Pharmacy Solutions is not like a normal pharmacy, like a Walgreens and a CVS. What's unique about Pharmacy Solutions in Arlington, Texas?
Sure. So Pharmacy Solutions is a compounding pharmacy. Everything we do is compounding. So no traditional prescriptions. We are making everything. Pharmacy Solutions has been in business for 30 years. We specialize in bioidentical hormones, also in weight loss, also, doing a number of other things, ophthalmology, vet compounding. We do things for thyroid, and we do creams, topicals, injections, capsules, anything that you can think of. And the whole idea behind compounding is customized medication.
Okay.
So the concept behind us is we can specialize the medication for you and really get that dose where it needs to be. I think the message about who we are is that, we're passionate about helping patients. And so our mission statement is absolutely to help every patient through compounded medications, create positive patient outcomes.
You mentioned that you don't handle just normal prescriptions like you could get at a Walgreens. You just don't do that at all? It is all compounding. So you can't get, if somebody's got... they would normally get prescribed, let's say somebody who has ADHD and they've got, the Vyvanse or the Adderall. You don't mess with any of that.
Correct. Okay. And, there's such a demand for what we do. Years ago, we decided just to focus on the compounding element, and that is so we could really hone in on that customized dose. So the whole idea is if you are that ADHD patient and that medication isn't working for you, that dose isn't working for you, we can take what you've been doing and tweak it, add dosing, change the route, do things to it to really apply it to what you need and make it work for you. And so that's kind of the whole concept behind compounding, where we can really get a solution for a patient based on what they need and what we are able to do in our lab.
That's interesting because, there's the word pharmacy and pharmaceuticals has kind of a negative connotation these days, right? You watch TV back when Ronald Reagan enabled pharmaceutical companies to advertise on television. And you see those long lists may cause death, heartburn, stomach, all these lists of things. And it's kind of confusing for the patients out there, or people. They go into the doctor nowadays and say, I need this because I saw it on TV, opposed to the doctor saying, well, let's figure out what's right for you. What do you think about big pharma and your uniqueness? You mentioned that it's very customized.
I think the one missing element when it comes to what we do is education. Just like you said, getting the word out to patients, what compounding really means for patients, and knowing that they have options to tweak a dose, go a different route altogether with a medication and get what they need is the message that's kind of lost out there because of big pharma. And while big pharma has its place and its need, medication is certainly needed on that aspect. It's not one size fits all. And so where we are able to come in is really customizing for patients and pets to hit it on the head and get what they need with different concepts in the medications.
Wow. Cause customization, I guess if you're a pharmaceutical company and you've got this product, the only flexibility you have is dosage, like more milligrams or the higher, stronger or less strong. But as far as knowing what's going inside your body that may or may not take well to that medicine is kind of up in the air.
True. And if you look back at, years ago where pharmacy started, it was making medications. It was beakers in a science lab, and it was a dab of this and a dab of that. And that is exactly what we do all day long, every day. We use scales, we use weights, we use beakers. We're mixing and weighing, and we do a lot of math throughout the day. And so we are compounding or customizing a drug for you. It can have multiple active drugs in it. It can have other bases in it. It can have different things in it, whereas a pharmaceutical product or a one-size-fits-all, a commercially available, whatever you want to refer to that as, is really just driven to have one or two things going on to where we can really kind of hit things on the head.
Now, who are your clients? I know that I'm a patient, so I look for a place to go to get my medicine based on what my doctor says. Do you serve patients like me, or tell me about your clientele?
Sure. We serve, as far as a business goes, we serve 29 states across the country right now. And that's going to be patients and physicians or providers alike. And so our goal is to reach as many of each of those respectively as we can. Again, we specialize in hormones and weight loss, but we also serve in all of those other areas. So any patient needing a medication that's customized, and that can be any medication that's out there. So we also do a substantial amount of business in the vet realm.
Yeah, you mentioned pet. I thought, wait a minute here. So a lot of us have pets. So tell me about that.
We've done some really cool things in the vet sector. We've done some eye drops for animals at the zoo. We've done, different things for animals over the years that are pretty profound as what we can do. We service a lot of the veterinarians in our local area. And that's a unique situation too, but there's commercially available products for animals that just don't do the trick, or maybe the dog can't take the medicine because of the situation that's going on. And so we're able to compound an injectable, or we're able to put something and rub it in his fur that will have the same effect. So different ways to take care of these pets and people.
A vet could call you guys up and say, hey, I've got this cat that has a unique situation, either ate or drank or something. We know that we need blah, blah, blah. And they would call you guys and say, can you help my client's pet?
Yes.
Really?
So if there's science behind that, then we can do it. Another thing about compounding and pharmacy solutions is that everything that we do from a dosing recommendation is there has to be science behind it. So, when we get those calls, be it a person or an animal, the first thing that we are obligated to do, and that we will do, is to look and see if there's clinical data and science behind that. So is there a recommendation for that? Is there studies to back it? Can we make a safe recommendation and dosage form for this patient?
And you literally go into research and development. Your pharmacists, I'm sure, have, since they are specialized in compounding, kind of combine their knowledge and their education with research and propose, a compound for the animals.
Yes. So we have lots and lots of resources at our fingertips for our pharmacists to tap into, and look at the studies, look at the clinical data, look at the dosage recommendations, look at the history of those things. And over time, over 30 years, we're pretty well versed on those top medications, be it for animals or patients. But we, as a pharmacy, I challenge our staff, whether it's the pharmacists, the technicians, or any other staff, to constantly look at science, constantly better themselves in the position that they're in. So we encourage them to do, external education events, to attend seminars, to blog. If you blog about something new and you're researching it and you're learning it and you're writing it, then that's just adding to your repertoire of information that you have, so we can be armed with more information for patients and providers.
I would recommend anyone to visit the RX Compound website. That's the URL that you'll see on the screen in front of you. But tell me about some of the programs you're working on. I'm familiar with Propel, dealing with hormone transplant. Is that correct?
Pellet therapy.
Pellet therapy.
Yes.
Tell me about that.
Okay. So Our pharmacy, again, we're passionate about education. I feel like one of the pieces that is missing when we look at providers and we look at patients, being that piece that kind of connects the two. As we've gone through the last 20 years, we see that doctors don't have as much time that they used to have to spend with patients. Patients are looking for resources. They're looking for education. They're trying to understand therapies, the science behind it, everything that they need to know to do this themselves safely and effectively. There's so much mixed information out there about hormones, about pellet therapy, really about anything in the whole realm of pharmacy. And so it's our job and our responsibility in our business to educate patients and educate providers. With Propel, our opinion is everything that was on the market prior to us creating this program was either not financially fair for providers, or it was an unsafe dosing model for patients. And so we felt obligated as a pharmacy to do something better. At that time, we were compounding pellets and had been for years, and a good pellet, the best pellet on the market. And so we knew the science behind the pellet itself. We understood the pharmacology of the pellet and how it played in the body, how it worked for males and females. We know that science, we know the dosing model, but what we needed was to create the tools for a provider to really put this into play in the practice. And so our goal was to create kind of a business in a box that a provider could say, hey, I want to put this in my practice. I don't want to sign a 19-page contract. I don't want to pay exuberant fees where I'm never going to make any money. And I want to treat patients safely and effectively, but I want to have an understanding to do so. And, this would create patients, income for them, patient traffic, so to speak.
Sure.
But it was also give them an alternative to what was out there in the market. And so we then started putting this program together. And the first
step... When did you put that program together?
It's been about 6 years.
Okay.
And the first step for us to do that as a pharmacy was in order for us to get out there and really stand on that front line and say, hey, we believe firmly in this, we had to make sure we did. And so while we were compounding the pellets, we really needed our pharmacists and our team to be on board with that science. So again, I challenged my pharmacist and I said, hey, we need to look at the science. And we spent about a year looking at every study, all of the science, all of the clinical data that's out there on pellet therapy. And, hormone pellet therapy goes back to the 1940s. And so we looked at these studies, we looked at the clinical data, and through the course of that year, our pharmacist dissected it, brought it to the surface, kind of weeded through it and said, okay, not only do we believe in pellet therapy, we believe it may be the best route of administration based on what these studies are telling us. And so now we want to take that a step further and we want to create a preliminary dosing model. And we want to put it to play into practice. We want to see this live in some patients and kind of follow that for a time period and see if, in fact, we get what the studies say we will get.
Interesting.
And so we did that. And so we put a dosage calculator together and we threw it out there with a few of our trusted practitioners and said, hey, would you please try this? Start with a baseline patient and move this model through for 90 days, and then 180 days. And can we see that clinical data? Can we follow these patients and capture that information to make sure we're hitting the levels that we're supposed to, that these patients are getting these safe, positive patient outcomes that we need them to get based on this dosing model. And what we found through the course of that, year and 3 months was that we could use a lot less testosterone, a better ratio of testosterone and estrogen, the right portion of progesterone, and in combination create positive patient outcomes for men and for women, respectively, by using a lot lower doses. And so that was what we needed as a pharmacy to stand on the front line and be bold and say, hey, here's a dosing model that works, that doesn't have to be as aggressive as what's out there. And then we needed the fluff around it. We needed some marketing around it. We needed to present that education piece. And so we have the 6 hours of education and training looking at bioidentical hormones for women and men, the science of the pellet therapy, the pharmacology of pellets versus the other hormones, and then how to really implement this into the practice with marketing and business development and all of the pieces that a practice need to be successful. So that program has been very, very successful for us. Now that we fast forward 6 years later, there's studies that have come out since then showing that not only were we right on the testosterone, we were very right. And so there's studies showing that, by dosing that much testosterone at such aggressive levels as what we're out there, there's increased risk for cardiovascular disease. Instead of having a healthful benefit, now we're really creating a risk for patients.
It's like nobody really took the time to, you keep mentioning science and education, but nobody just seemed to take the time to really dig in, and you guys really dug in and looked at that.
Absolutely. And, I never want to say that somebody would do something intentionally to harm a patient or harm the population in general. I don't think that's ever the intent. But what I do think is that they just put something out there without looking, like you said, looking at the studies and the science, and they took a shot in the dark and it worked. Well, newsflash, the goal with hormone therapy is not to create Superman and Superwoman. Our goal is to create a balanced hormone system. And so that is what our goal is, to balance hormones to get the healthful benefits of decreased risk of cardiovascular disease, increased, bone health, brain health, all of these positive healthful benefits that come when you're balanced when your hormones are balanced.
And is that something over time as like, that your body at one time may have produced the right balance, but over whatever it is, life, behavior, diet, exercise, age, that you just become deficient in those areas? And so most people who are unaware of any solution just kind of deal with it.
Unaware. That's the key word right there. And age. And age. It is a natural. It's a natural aging process. Is for your hormones to decrease.
I'm like, okay. I when I go to the doctor, doctor's like, you're low. You're low in your T count, and I'm like, I know.
Wait, hold on. Increased weight around the midsection, decreased energy.
What?
For women, it's the same thing. I'm not sleeping quite as good. I have brain fog.
Yeah.
Those are all the standard comments that practitioners hear all day long from women about, 40 to 60 and men around 40 to 55 and 60. So
you just mentioned 4 or 5 of them, and I'm like, check. And I literally am thinking, man, how do I combat this? I get up early. I'm riding my bike, but there's certain things that it makes me mentally more like proud of myself, and I feel better. But I have this feeling that it could be easier, but I'm scared.
Well, and I think, what science says is, yes, there's these symptoms as we're describing. Most of what we just said are symptoms, but the value and the benefit of pellet therapy or just bioidentical hormone therapy is the increased health benefits. What I said earlier, the decreased risk of heart failure, of cardiovascular
I've got heart disease in my family, and I'm always looking at that. Yeah.
Decreasing symptoms is what we feel, but increasing the healthful benefits is what we need. That's longevity of life, and that's quality of life. And so the healthful benefits that come from balanced hormones are what people don't realize they're missing out on. So while we can cope with the symptoms and while we can live with the symptoms, what we're not getting is what's really detrimental long-term.
See, that's the thing. You said it. I'm almost afraid. It's like crossing over. So you cross over. If I were to go and get hormone replacement, to get a pellet that would help balance my body for the better, I'm like afraid, is it going to turn me into somebody different? Am I going to have, is it just going to be like, wow, I feel like I'm young again? I'm afraid, because it's like, you can't undo it. It's like when you do drugs, you can't undo drugs, Sure. And you know what? That's a valid concern. That's a valid fear that patients have when they consider pellet therapy, to say, oh, I'm not sure I want to do this. Once you put it in, you can't take it out. And that's very true. But the key is going to a practitioner that understands what they're doing. Okay. And so there are, you'll hear patients that say, oh, I tried pellet therapy and I didn't love it. And those are patients that tried and didn't get the correct dosing model. And they had these negative effects. They had too much testosterone, so they had hair growth. That's a common one in women. That's not good.
They had masculinity
No.
increase and, those types of things. And so we want to avoid symptoms like that. We want to balance hormones and keep those levels where they should be. And so, yes, you have buyer's remorse.
Right. I'm afraid also that, oh my God, this is so great. Now I can't live without it. But, I'm an ADHD guy and I've been on ADHD medicine forever and it was life-changing for me. I couldn't imagine not being on it because it's really helped me and my family and the quality of life. So it's that same kind of thought, like, if you go and get the pellet and get your hormone therapy that's dosed properly for you or me, I'm excited. I would be excited, but also afraid that like I'm going to need to do this forever. But hello, if your quality of life is better and you found a solution to make you feel better and live longer and decrease symptoms of things like heart disease. I've got heart disease in my family. Luckily, I don't have cancer. But these are things I'm very curious about. So I am going to be looking and talking to you a little bit more about that personally, because I'm a Gen Xer. I'm 51 years old. And the doctor keeps telling me, you and I'm like, I know. And I'm afraid I'm a guy, maybe a stereotypical guy. I don't want to go to the doctor. I don't need any of that stuff. But I've seen some results, even on your website, some testimonials, and it's got me curious. I have some friends who are doing it, and I'm pretty close. So thanks for sharing that with me, because I am a little scared. But you guys, if I did go to my doctor and say, my family doctor, and say, I think I'd like to do this, how would I be able to get? I don't want him to give me somebody that's off the shelf that's got too much of this or too much of that. Would I tell him, Dr. Arvin Shine, shout out, I have this relationship with this Pharmacy Solutions. Could you recommend, how would that work?
Yes, absolutely. You can ask your provider who they're using. I think it's fair, and I think it's our responsibility as patients to understand what we're being prescribed, what their dosage model is, what pharmacies they use, what products they use. I think those are questions that patients have to ask. And I think there's this understood silence that we just go in and we accept what our doctor gives us. And I think that's, as a pharmacy, we're the first ones to tell patients, hey, stand up and ask those questions.
So if my doctor hasn't heard of you guys, I could say, could you contact them?
Yes, and direct them to our website. There's a place to become a prescriber. Even if they're not a prescriber, it's not about, for our pharmacy, it's not about just doing business with somebody. That is not how we built our business after 30 years. We built our business from helping patients and helping providers. And we do that all day long, whether you buy something from us or not. Our goal is to help patients, is to help providers, and we know in turn we will have a relationship for a long time going forward. However, we can be that resource in the middle for both parties. That's where we want to be.
You did mention, what is that symptom called? Bulging belly. You've got another program that helps with people losing weight. I have struggled with weight pretty much my whole life. And I've had ups and downs. I've done the Atkins diet. Which was good for me, but then I stopped. I couldn't just eat cheese and meat all the time. I had to do something. So then I'd gain the weight back, and it was very confusing for me because, I've got behaviors. I don't sleep as much as I don't know how much sleep I need. I also, eat when it's convenient. I try to eat healthy. I need to exercise more, but I don't know what kind of exercise. Okay, you're making some motion. So I am a prime candidate of somebody saying, I've seen every weight loss program out there. You've got a new program called Transform that I'm curious to know more about. Tell me about Transform.
I love Transform. And you just said you're a patient. You're an ideal candidate for Transform.
Lay it on me.
So the difference between Transform and any other weight loss program out there is we are not a diet and exercise program.
I hate exercising, by the way.
And we are not just trying to attack that middle weight gain, that you have. We're not just about pounds and inches. There's a much more complex part of this program that has not been hit by any other program, and that is addressing why we have unhealthy weight. And that's the root cause of weight gain. So when you look at it, there's a couple different aspects. There's why we gain weight and there's why we don't lose weight. That's two-part. And so we want to address those root causes. You mentioned a couple. Behavior is one of them. So binge eating, psychological eating, you're upset, you go to the pantry.
Celebrate,
you go out. There's all kinds of psychological factors there. And then you have sleep. Sleep is a factor that plays into weight gain. Stress or adrenal function.
Oh, yeah.
When your stress is through the roof, that changes the way you metabolize. It changes the way you function. And that has to do with weight gain. Hormones has to do with weight gain. And so I've
wondered about that. I've wondered about when the doctor keeps telling me, your low T count is, you're low on your T, you need to get that up. I was wondering if I did bring that up, would that result in maybe, more energy, more desire, more behavior to I feel like running. I feel like doing something more active. I don't know where this is coming from because right now I just want to sit down and watch Netflix, but I want to do it. Does that make any sense?
Yes.
I want to do better.
Well, and I think it's going back to balance, and it's going back to looking at all of these underlying root causes and really looking at the foundation of everything. With Transform, we are not looking at diet and exercise. And really what starts as a weight loss program ends up as a wellness program. What we know about this is our goal, again, much like Propel, was to create that educational piece and challenge our pharmacists to say, hey, what is the science behind weight loss? Why are there all of these weight loss programs out there, but none of them really are effective? They are effective for 30 days, 60 days, 90 days, maybe a year. I hear it on the radio. I lost 40 pounds and I've kept it off for a year.
Right.
Well, great. What's going to happen when you start eating more than 30 calories a day, or whatever crazy, intake you're on? Basically, you're following this program and you're like, I got to stay on this program. And as soon as you go off, you kind of go, now what do I do? I cheated and do I have to start all over, or how do I do that? It's very mind-boggling from buying the meals, the preset meals, Weight Watchers. You get these meals and you spend money, you go in and get counseling. You really feel like a victim and you feel helpless. And so you're vulnerable. Sure.
You're like, I'll do anything. And then you do it. But like you just said, if you don't follow it, is it realistic? So understanding all this is still, to this day, I hear the same radio ads that you just mentioned. And in my mind, I'm like, maybe I should try that. And I go, no. I used to smoke cigarettes, and I said, I don't need no patch. I'm just going to quit cold turkey. So I did. So I'm like, cool, I can do that. Surely I can lose weight cold turkey, and I can eat. I know I'm supposed to eat vegetables, and I know I'm supposed to exercise, but it's the behavior that is. It's these little habits that you mentally do that justify whether you do it or you don't, and it's frustrating. Anyway, I'm probably babbling, but if there's anybody listening that goes, yeah, I know what you mean, because it's a mind puck. So
again, we're going back to customized medicine. It is not a one size fits all. Nothing that we do in our pharmacy is one size fits all. And so we don't pretend to have a dose, a weight loss program that is going to be, hey, here's the model, follow it. We had to go back and we really had to look at the science about this. We've been compounding weight loss formulas in our pharmacy for over 20 years. And that's a combination of many different active drugs that play in that weight loss process. And so when I challenged the pharmacist to do this, I was waiting for this magic piece for him to come back and say, hey, I found it. I found this one phrase that nobody else has found so far. It's not in any of these other programs. And this is what you can take this to the bank.
Right.
And he came, one of our pharmacists came to our door and said, it's not there. Really what weight loss is about is, the less you consume and the more you exercise.
Calories in, calories out.
Yeah, it's what you take in and what you burn.
Yeah.
And so we get that. We know
I
that
can
has,
grasp that logic.
we know
Correct.
that. And so I said, okay, we have to take this a different spin. We have to look, because there's something else there. Instead of looking at what we consume and how we burn off that same amount, we need to look at what is causing this in the first place. So let's turn our hat. Instead of looking at the science of just weight loss, let's look at what these root causes are. We know, as specializing in hormones for over 30 years, we know hormone balance or lack of play into weight loss or weight gain. And so we know hormones is a factor. We also know, specializing in thyroid,
I was just going to say
that thyroid has something to do with this.
Yeah.
We know that we deal with a tremendous amount of patients that have sleep problems.
Or what's the other one?
Sleep
Metabolism. You know,
Metabolism
you
is
got a slow metabolism. That's why.
We know that people with adrenal function or adrenal fatigue.
What's adrenal
stress,
again?
Stress.
Okay.
And so that stress on the body can play into weight gain. So we're looking at all of these factors that may have it. And so when we started diving into the science of those core issues, behavior, binge eating, what is it about obesity that is different? What is it about diabetes that is different? And we started looking at all of these pieces and trying to understand those key pieces for weight gain or weight loss or unhealthy weight, however you want to categorize that. And what we found was, okay, here's all these root causes of what's causing the unhealthy weight, but how do we address those root causes one by one? Well, if you take that on the flip side and you look at the pharmacology of medications and you look at these active drugs, they all have a role. They all have their purpose in the weight loss process. So our goal was to say, okay, we have to have an understanding of what's making this patient tick. You know, what of these root causes are really underlying issues in this patient that are creating unhealthy weight, be it 5 or 10 pounds that they can't get off or obesity. They're both problems for that particular patient.
Sure.
They're just a different structure. And so how do we address these problems in a patient-specific, customized dose using the science of medicine instead of diet and exercise? This is not diet. And so we know that there's $70 billion in the weight loss market. We know that, the average American will do 126 diets in their lifetime.
The thing of when I was really conscious about supplements and vitamins, I would go into a place like a GNC or a vitamin supplement store, and this one would help curb sweetness. So I would literally take like 8 pills, like this one, phenolphthalein, and this one was chromium picolinate, which helped with the, burn. I was doing low carb, and so I felt like it was supporting my deal, and did it, and I felt good. And did it curb my craving for ice cream? I think it did, but I think it was up here. I don't know. I was doing it, and it said there has to be individualized ways to. Everybody's different.
And so Transform has a unique tool in that. After we learned this piece that I just explained, we took that and put it also in another calculator, which is a 2-part calculator. So this is very much dependent on the subjective part by the patient. We need that understanding of what's making them tick, like I mentioned. So, there's 60 or 70 questions that they need to go in and answer.
Okay.
And that's going to give us an insight to how that patient works. What is the quality of their life? What are their behaviors? Behavioral patterns, what are they doing? And by capturing that information in this calculator, and then adding the clinical portion. So the clinical side is adding medication interactions and counteractions, looking at medical history, understanding different labs.
This is
thyroid.
All in
this is all in a calculator.
So you mentioned the calculator under your Propel, the home run thing. You created a calculator for that, and this is another calculator?
This is a separate calculator.
Nothing off the shelf. This is like customized calculator.
There's nothing like this out there that will capture that patient information, and that's what's been missing. You can have a weight loss drug all day long, but the only way that can be effective is one size fits all, because they don't understand the patient's subjective side.
So in the qualification or identification of this person, give me a couple of the questions that I might relate to, like, how much do you sleep? Or are there any questions that I could,
one of the funniest questions that I thought was on there was, do you get frustrated when you're sitting in traffic? What does that have to do with my waist?
Yeah.
But it does. It has everything to do with how stressed out you are, how quick you want to do things, your behavior pattern. How do you respond to anxiety or stress or sadness? And it asks it in a vague way that the patient doesn't really understand what's going on with that, but it's identifying behavior patterns and triggering psychological responses that are somewhat creating a score.
Okay.
And so those are ways. Yes, there are tables on the backside of that calculator that are very, very complex and comprehensive. With this calculator can give from over 100 different formulas that are customized, that are unique for each patient, that vary in strength, in combination of drugs. Okay. So it can have multiple drugs in it. We're also using
that makes sense.
We're using a proprietary base that will give, vitamins and antioxidants to really boost metabolism and energy. And so there's a combination of things coming in here, not just, hey, here's one drug at this dose and this is going to do this.
Okay. So after you answer the questions, it really through the magic of algorithms and your calculator, does it produce recommendations on what to do from a lifestyle standpoint? Does it include supplements that are, like you said, I might need more vitamin D and I might need more chromium picolinate, opposed to somebody else who's got plenty of that, and but they're less or more on that.
We all need vitamin D.
We do.
We all need vitamin D.
Yeah.
But yes, it's going to make recommendations for not only a compounded, medication recommendation based on those root causes. It's also going to recommend quite a few supplements. There's a strong correlation between the science of supplementation with regards to the weight loss process. And so we know that these underlying root causes also need supplementation to make the weight loss process effective. And so the results that we're seeing and the most successful patients are the ones that are following this protocol, that are doing the medications with the supplementation, following this for at least 90 days. Science says that medical weight loss is most effective around 180 days.
Okay.
So 90 to 180 days is really what we're seeing. But, we were expecting, when we launched this program, we were expecting to see pounds and inches, and we're seeing that. We're seeing patients, an obese patient lost 30 pounds in 30 days. But the same obese patient where it's remarkable for me and where I feel like we are making a mark in the community and in patients is this same obese patient, while 30 pounds in 30 days is great, and that's only going to continue to increase. This patient is going to continue to lose weight, but this patient is also off of a statin drug after 2 months. He didn't refill his statin drug. So now we're seeing an increased benefit on heart health, where he didn't increase his diabetes drug. And so which a
lot of those medications treat the symptom, right?
Correct.
And this is kind of going, like you said, the root cause, the core of the problem. And if you fix that, these other things that you were taking to treat those symptoms that your doctor said, hey, here, just take this, or whatever, now they're not having to take those medications. That's interesting.
Well, and we've got patients with pain, fibromyalgia, they don't have pain anymore. Headaches, migraine headaches are gone. So while I can give you testimonies all day long of pounds and inches, 30 pounds, 17 inches all over body in 90 days. Some with the final 10 pounds, some with, obese patients and losing 40, 60, 80 pounds.
Wow.
And so the weight loss is there, but the healthful benefits are there also. And that is where, as a compounding pharmacy, we rise above and we set ourselves apart from any weight loss program. I'm not about a diet and exercise program. There's plenty of those out there. Mm-hmm. We wholeheartedly and passionately believe in nutrition and wellness and eating good food and vitamins, and that's essential to our well-being.
Sure.
And we're not saying don't exercise and don't diet. We absolutely believe that's a key component. But we also know that there's a lot of patients out there that won't do it or can't do it. And so if that's not working for you, if that's not a method of your choice, then here's an alternative for you, or here's something for you to kickstart it and get this going, to reset your metabolism, get those final 10 pounds off, give you an energy boost, and get going on some things. And the testimonies have been remarkable by the providers and the
I was
patients.
just going to ask you, if I went to my doctor, do people still go to their doctor and go, I need to lose some weight? And they go, and they actually can tell you what to do or advise you. And then there's the people who watch the TV and they see stuff that, I need to try that, or the radio. If I went to my doctor, how does my doctor know that Transform exists?
The same way, our website is the best place to refer them to. And, it's funny, as we are presenting this out there to providers, the question isn't, is there demand in their practice for this program? Every practice across the United States has the demand for a weight loss program.
Right?
Well, in the United States, unfortunately, yes, the demand is there.
There's not we just don't see people that are looking to lose weight anymore.
Unfortunately, our statistics show that our population, the demand is there. But the question is, do they have the will to put this in their practice as a program? This is designed for any provider to slide into their practice, regardless of where they are, to any specialty, any type of practice, whether they're treating weight loss or not, to help these patients and do it. It's very easy to start. They go to our website, they can become a provider, and they can onboard very, very quickly.
I'm not very knowledgeable, but if I were a doctor and I said, hey, I'm interested in this, what would I do? Would I incorporate this into my practice? And like, if they have, my patients ask me questions that I might not know the answers to, but maybe you do. How do I support my patients, even when they have lost, let's say 30, 40, 50 pounds, and they're asking me questions, what do I do now? And, tell me about that.
We never want to put our providers in a situation where they can't answer questions for their patients. If we give them tools, we give them all the tools. And so they are armed with a provider portal that is absolutely stocked full of patient education, patient resources, blogs, studies, patient handouts. It even has diet plans on there. If they have a patient that wants to seek an alternative for their eating choices, they want to follow a keto plan, they want to follow a high protein diet, then there's resources on there for them to do that. So we're not saying don't incorporate diet. It's just not a diet plan.
They could literally know that a patient's coming in the next day and why they're coming in, and log into their portal and kind of get some information. They know the patient. They've been their doctor for a long, long time, and literally have the knowledge to guide them. That's pretty cool.
Yes, and everything is online on demand. The training is on demand. They can do the educational modules on demand. They have access to the calculator immediately. Once they onboard, the link is established with the practice, and that's what they send to their patients to start that calculator process. So it's a very simplistic process, but a very complex calculator and method behind it to give a very unique dosage. So
it's probably got to be expensive, though.
Very cheap. It's very inexpensive. It's easy for a provider to get in. We don't want that to be a reason that they don't do business with us.
I mean, part of the reason I didn't do Weight Watchers because it just cost. I had to download the app and then the whole program. And I told my wife, I don't think I can afford to lose weight.
The Transform program for a patient.
She goes, just don't buy any food. I'm like, no, I got to do something like that.
Is about $8 a day.
$8 a day.
On average, $8 a day. Now that's very difficult to gauge. That's based on our recommendations for the provider on what they charge for consultations. Of course, a provider can charge whatever they want to.
I don't know about you,
there's going to be some variation in that.
My daughter gets Starbucks every day, and then that's around $8 with the little cupcake that goes along with it. So $8 isn't a lot of money. It actually sounds like, how could that be possible? Because there's a lot of you've done a lot of work on this, and is it explain to me that. How can it be so affordable?
We try to keep everything cost effective for the providers and the patients. We need it to be cost effective for them to live a life of wellness. And that's not just in weight loss. That's everything that we do. We are compounding. So it's specialty items. It's customized medicine. So it's not billed on insurance. These are cash pay. But because of the nature of what it is, and it's, it's a 90, 180 day program. We realized that they have to be on this for, a while. And so it needs to be cost effective. When you compare Transform to other medical weight loss programs, there's not another one that's backed by a pharmacy. There's not anything else out there looking at root cause. And there's nothing even close to this on price. Most of these are, in the $1,000 range to get started for a 90-day, period.
Have you, you make a did you try it yourself?
Yes, I have.
You have?
I'm on 92 days.
92 days. What was it like for you?
I loved it.
This is like the doctor who invented this thing that's, but before I give it to my patients, I want to try it on me first.
I do. I try everything in the pharmacy. Anytime we do any kind of program, I bring it in the pharmacy because I have to know, A, if it's going to work, B, what it feels like, tastes like, smells like. I just want to know the answers to the questions before they ask them. So that's my personality, and I wanted to do it. I also had, about 10 pounds to lose that I wanted to. And people, I'm tall and I'm a thin person by nature. So it's not anything I like. I understand some people would look and go, what business do you have doing a weight loss program?
Well,
I get it.
Everybody looks in the mirror. Everybody has their own image. And so, yeah, I get that too. You see things that other people might not see. So your 10 pounds means more than people why do you lose it? Well, you need to lose weight.
But I was at a point where I couldn't have gotten those last 10 pounds off no matter what I did. And I was exercising. I was eating right. I needed to reset. I needed to reset my metabolism. I needed to reset my brain. And I did. And I wasn't sleeping great. And so when I started the program, I immediately started losing weight. I have lost 19 pounds, actually.
19?
And I've lost 4.5 inches on my hips. I've lost 3.5 inches on my stomach.
Good for
I've lost weight in inches on my thighs, my arms, my chest. I mean, just all over. So there was a complete body shift.
How's your mind?
But I was going to say more than that. My energy was through the roof. My brain fog is probably the one thing that I noticed. I didn't have any pain or migraines or anything like that to report prior. But brain fog, I didn't think I had to report until now. But I would tell you that is gone. So I feel great. I do feel great. And I think just getting those last few pounds off helps. And I think because of the base that we have our compounds in and all of those things working together. And then I think addressing those root causes, when you start sleeping better and your stress is managed better and you're taking those supplements and you're getting that protein and you're doing those things, then that kind of all comes together. And so that's what it's all about for Transform patients. And I think just getting that message out there that this is more than just diet and exercise, and it's not one size fits all to take a capsule and be done with it.
Folks can go onto your website, rxcompound.com, and just see where the word is Transform.
Yes.
Transform program.
It's pstransform.com. Like Pharmacy Solutions, pstransform.com.
All right. Well, I would encourage people to check it out. And thanks for taking the time today to explain this. I've heard some buzz going around, and to hear it from, I don't want to say horse because that's just a metaphor, the horse's mouth, but the person who really conceptualized it, talking about it is really enlightening. So thanks for coming on the show. Maybe I can start on it and do a follow-up and see how it works for me.
You got a deal.
All right. Sounds great.
Thanks for having me.
You're welcome.